Good morning. This is Dr. Timothy Scott Beck. It is October the 27th of 2025 on a nice little rainy Monday with the fall bearing down on us pretty hard this morning. So feels good outside. This is a great time of year, and the leaves are changing. I don't know if this rain will knock them all off or not, but we'll get maybe another week or so of leaves. All right, so let's talk about a few things. So first of all, as you guys may or may not know, um, we I own my own company here, but through your insurance companies or whatever, we are managed by different organizations, and Medicare um, has pretty much made it clear that if you want to thrive in the Medicare environment, you have to be managed by this thing called an accountable care organization. And we're a member of them. And if you're a Medicare patient, you actually are too. This was set up through Obamacare. And so the way it works is if you see a provider so many times a year, they get designated as your accountable provider. But they also give us different things that we have to do throughout the year to meet their standards. And one of the things that they wanted us to do, and I bucked it when I first started, but I realized that they're not going to let me buck it, was this service called IRIS, IRIS. And what it is an end of life discussion that they wanted me to consult all my Medicare patients with. They wanted me to send out a referral to IRIS for my Medicare patients primarily. But and what they're supposed to do is they're supposed to contact you and work through your living will, your powers of attorneys, all the legal and medical and ethical stuff that you need to do to manage yourself at the end of life. Now, I think it's a good idea. I really do, and I've seen some terrible situations come about where patients did not take care of their stuff and they got handled or treated less than optimally based on what was going on with them. So, and the most important thing with all that stuff is, from my standpoint, is I want to hear from you what you have to say. I want you to guide that, and the only way for you to guide that is to address the issues before it becomes extreme or before you become incapacitated. So I'm making referrals. They will be contacting you if you're a Medicare patient. And I know it's hard with all this scamming going on to tell who's legitimate or not, but they should identify themselves as IRIS coming from my office. I recommend you use the service. I do think it's valuable, but the most important thing is we need to hear from you what you want during that time. And if I can have it in advance, I'll honor your wishes and try to do the best I can to honor what you've put down if and when that situation arises. The next thing is flu shots. We do recommend that you get a flu shot in October at the latest, so to cover it. Now, you can get it after that if you need to, okay? But we've got our flu shots here for everybody. If you need one, come on in and get it. We've got the flu shot for the 60 and older and then the 60 and younger also. And remember, if you get a vaccination, a flu shot, and you have an inflammatory reaction to it, that is what we were trying to invoke so that we know you've got immunizations. And I also realize that the vaccination stuff has really been thrown into chaos with all the stuff that's happened in the last few years, okay? But I still believe the flu shot's legitimate. And okay, and then last thing, speaking of shots and everything else, I always on these videos I put up some kind of clinical thing that I have been seeing recently. And so over the weekend, I'm pretty sure I had two patients who popped up with shingles over the weekend, and they called me, and I was able to initiate treatment. And I want you to be aware of shingles, okay? And what shingles does is when you have a virus that's already been established in your body, and we usually get it through chicken pox, it will come out and it will run along a nerve line and it will wreak havoc on that particular nerve. And then when it when it really shows up, it'll start with pain or a gritty feeling on a dermatome, which is a dermatome is a nerve lineage that comes out of your spine. And then a lot of times you might see little dots or little zits come up along those lines, and it'll be extremely painful. That is shingles. And again, it's caused by a virus. We do have treatment for it, but it's really important that if we order the treatment for you, that you start that as soon as humanly possible, usually with an antiviral medication and a steroid. You have to hydrate well during this time and get treatment. Now, if you're over 50, we recommend that you get the shingles vaccination that keeps that from happening. And you can ask for that during your wellness. That's one of the things we go over during your wellness. But anyway, we do have an immunization for the shingles. The main thing, though, is if you see shingles, which you're going to have a painful line of what looks like little zits coming on, you need to be seen at the office. That's one of the reasons we do same-day appointments, so you can be seen promptly if you get these shingles. All right. So thank you so much for listening to me today. Our number is 706-782-0016. We're here for you today. Go to our website, drtspec.com. Email us at office@drtspec.com. Do whatever you need to get a hold of us if you need to be seen, and we'll get you taken care of as soon as humanly possible. Thank you so much for listening to me today, and please call us if you need us.